I also spent quite a bit of time here in East Tennessee and in Knoxville. And when I lived here many years ago in a prior career, I decided that my fiance at the time, but now my wife of over a decade, we fell in love with East Tennessee and Knoxville and decided that we wanted to do what we could to get back here. And so in the way of training, I did my undergrad at Georgia Tech. I did a lot of my medical training at the Medical College of Georgia down in Augusta, Georgia. For any golfers out there, there's a little golf tournament in Augusta called the Masters that we used to attend. So a great little place to train. And then I spent one winter up at the Mayo Clinic. The Mayo Clinic has been ranked the #1 hospital in the nation several years in a row now. I did a shoulder and elbow reconstruction fellowship. So additional training with some of the best researchers and implant designers, really that the world has to offer up there at the Mayo Clinic. So that was a great opportunity for me. They take care of more complex shoulder problems than any other place in the United States year after year. So it was a great year. I did almost 500 procedures. I've published over 30 presentations and publications that have been presented nationally and internationally, primarily in the shoulder and elbow world. I've authored textbooks and have fortunately been blessed to receive regional and national research awards in the shoulder and elbow reconstruction world. And so while this was a great year, these are some pictures of my family that I'll share with you there. And we enjoyed the view down here on the right. This was off my back porch, so really pretty view. The problem is I'm not much of a snow person. And so while we had a lot of snow down there, I am very grateful to be back home and look at views like this here of Knoxville and East Tennessee and the Smokies rather than being in feet and feet of snow in Minnesota. So with no further ado, we'll try to touch on each of these common pain generators of the shoulder, really talk about the most common things I see and talk about the treatment options that we have for you. So usually the reason people end up in my clinic is because they say, you know, my daily activities are being affected. I'm no longer able to do the dishes. I can't do my hair. I can't get my billfold in my back pocket. Little simple things that you used to take for granted, and now you're having problems doing. And so that's usually what prompts you to see me. Another common complaint is night pain. So they say, well, you know, once I get going during the day, doc, I do okay. But at night, I just can't sleep. I can't get comfortable. I constantly roll over and my shoulder's killing me. And so for most people, it's a symptom of pain. For some people, it's more of a problem of loss of strength or loss of range of motion. And then sometimes it's a combination. You have pain or a compromised function that really limit you from being able to enjoy your daily activities and keep you up at night. So the most common things that I see in my clinic are a combination of soft tissue injuries, which can be bursitis or rotator cuff problems. Sometimes the bicep tendon is a problem. So these are all kind of soft tissue injuries. And then unfortunately, a lot of people suffer from arthritis or they have a fracture. And so we kind of have two big categories. We have the soft tissue injuries and then the bony problems. So in order to understand what's abnormal, it's sometimes helpful to understand what is normal. So this is normal anatomy. Hopefully you can see my pointer here. The ball is the humeral head there in the socket, and the ball and socket is what makes up the shoulder joint. And then above that, we have the roof bone of the shoulder called the acromion. And then over here, we have the clavicle. And that's the collarbone that most people can feel in the front of their shoulder. So this is what kind of normal bony anatomy looks like. And then if you look at the soft tissues, these are some images of the soft tissues. And this is the rotator cuff over here on the left. You'll see the rotator cuff is actually a combination of 4 big tendons that insert on the shoulder and help move the shoulder joint. And it also helps stabilize the shoulder joint. And so these are all kind of fancy names, but what you hear is the supraspinatus, the subscapularis, and a number of other tendons. The long and short of it is that these tendons help stabilize the shoulder, but unfortunately can also be a source of pain. So typically when I see you as a new patient, we'll get an x-ray, and this is a pretty normal looking x-ray. Again, the ball here and the socket here, the roof bone and the clavicle or collarbone up here. So this is kind of what normal looks like. Unfortunately, when things are no longer normal and they're causing pain, the most common thing that I see is what we call bursitis or impingement. This bursitis over here on the left, the bursa is a fluid-filled sac that is designed to cushion the shoulder. And when everything is healthy and looking normal, this isn't a pain generator. Unfortunately, whether it be overuse or maybe you've had a fall or something that's inflamed this area, this bursa becomes a hot red area that is really painful. And when this gets flared up on you, nearly any motion can become painful for the patient. Fortunately, we typically have conservative treatment that will cure this. We often talk about activity modification, we talk about therapy, and oftentimes we talk about anti-inflammatories or injections. And if these all fail, then unfortunately sometimes you do have to talk about surgery, but the vast majority of people will respond to non-operative treatment. If we do have to talk about operative treatment, fortunately, I've been able to utilize a minimally invasive approach to the shoulder, which allows you to heal pretty quickly. You can see over here on the right, we use a camera and we only have 1 or 2, sometimes 3 very small little incisions that are smaller than your pinky nail to do our surgery. And this can allow for a much quicker recovery for patients. Well, what if this bursitis has progressed and now it's truly a rotator cuff problem? Well, the rotator cuff is often a pain generator in the shoulder, and the rotator cuff is a thick tendon structure that can get worn out over time. Sometimes it's a degenerative process where it changes as we age. Other times it's an inflammatory process, and then unfortunately these symptoms or these diagnoses on the left, the tendinitis or the tendinosis, can progress to a tear. And once you get a full tear of the rotator cuff, that can become a bigger problem for patients. Not only does it generate pain, it can create weakness and stiffness, and can also affect your ability to raise your arm and affect your motion. These are some diagrams looking at the rotator cuff. And if you look at this image over here on the right, you'll see that the supraspinatus is one of the main culprits. This is the big tendon on the top of the shoulder. The big tendon on the front of the shoulder is down here, the subscapularis. And these two tendons together can oftentimes create tears and can be very painful and problematic for patients. I included this slide as a bit of education for patients to understand that not all rotator cuff tears are painful and not all rotator cuff tears need surgery. This was a study that I like to include to show that they looked at almost 100 patients who had an MRI of their shoulder that had no pain whatsoever. They had no symptoms, no pain in their shoulder, and nearly 1/3 of those patients had some sort of rotator cuff pathology. And so I say that to educate you that you can have a rotator cuff problem that may not be symptomatic and may eventually become symptomatic. And I also tell people that not just because you have a rotator cuff problem does not mean that it's going to be painful, and is not going to mean you have to have shoulder surgery. And so oftentimes these things can flare up and become problematic, that we can calm these down with these same conservative treatments we talked about. And so oftentimes we do have treatments that are not surgical that can get things settled down and can get you back to enjoying your lifestyle. Unfortunately, sometimes these don't respond to conservative treatment. And if they don't, they may require us going in there. Again, I'd use an arthroscopic approach for 99% of my shoulder surgeries that involve the rotator cuff. We're able to go in and put some stitches in, and we're able to repair that rotator cuff back down where it belongs. We utilize new technology. We're able to do things that were 10, 15, 20 years ago were no longer available, or were not available. And we have new technology that really aids in patients' recovery. And we're able to really utilize these technologies to allow patients to recover quicker and in a less invasive manner. We have technology like, these are kind of technical terms, but knotless technology and double row technology. These are all mechanical ways to heal the rotator cuff that we didn't have at our disposal 15 or 20 years ago. And so I was able to bring this with me back to East Tennessee, back to Knoxville, to offer this to my patients. We also have some really neat technology down here on the bottom, which we're able to utilize to induce the body's natural healing response. We're able to put patches over the rotator cuff, and this can really stimulate the body's natural healing response, and sometimes can actually slow the natural disease progression for patients. And so for certain patients, this is something that we've been able to utilize in the past roughly 5 years or so, that has really been a game changer for some patients. So on to other soft tissues injuries. The biceps tendon is a common culprit for pain. The bicep tendon can get tendonitis in it and can create labral problems, which are also sources of pain for patients. And so this tendon inserts up here on the top of the shoulder. You can see here it can become hot and inflamed, and this can be a significant pain generator. Sometimes if this progresses, you can have an actual labral tear that is associated with the bicep tendon. And there are a whole host of different tendon tears or labral tears that we could talk about, but suffice it to say that we also treat these conservatively at first with the similar, kind of treatment modalities that we talked about. And you can get these injuries from wear and tear or from a fall or potentially lifting a heavy object. Any one of those things could create this problem. And so on to our third big topic, which is arthritis. Arthritis is the bane of a lot of people's existence. I tell you, it can really be a pain generator and can really slow people down. This is a picture of what arthritis looks like in a diagram. But the analogy I give people is that if you think about a freshly fallen snow, these are ski slopes. And if you look at these hills of snow, you'll notice that they're very smooth. It's a really nice smooth surface here. Well, sometimes when you get arthritis, you get ruts in the snow. And so then the nice smooth surface is no longer overly smooth for patients. And unfortunately, this is painful. This cartilage, which was previously there, now has ruts in it. And these ruts can become painful. They can create popping and cracking and snapping of the shoulder. And then as the arthritis progresses, these smooth snow hills are no longer there. The cartilage is all gone. And all you have left is these rocky ridges underneath. And so if your shoulder has gotten to this point, it can be incredibly problematic for patients. This pain can keep you up at night. It can affect your daily activities. And this is really no way to live. This is a picture of arthritis and what it looks like. Again, on the left is our normal looking shoulder. On the right, you see there's no longer joint space. This ball is now eroding into the socket and you get bone spurs. And again, this is just an unhappy, very unpleasant situation for patients. The other reason we oftentimes get arthritis is we may have a huge rotator cuff repair, or a rotator cuff tear. So this is a picture of, again, what a normal shoulder looks like. Smooth surfaces, smooth socket over here, smooth ball over here. This is a healthy looking bicep tendon. And then down here on the right, you'll see what is an intraoperative picture of what a humeral head and a glenoid socket look like when they have significant arthritis. It's no longer a nice, smooth, white surface. It's an angry, inflamed, red hot surface. And so you can imagine, you don't have to be a doctor to know that this up here on the left is pretty happy, and down here on the right looks incredibly painful. And so if you have a rotator cuff tear that has failed to respond to conservative treatments, and you may have what we call an irreparable rotator cuff tear, a tear that can no longer be fixed, then oftentimes you'll have advanced arthritis secondary to this problem. And so then once you understand that your ball is no longer in the socket, like this picture here, you can imagine the ball belongs down here, and instead the ball is up high like this. This can be a significant pain generator for people. And again, will advance your arthritis, even though you may not have had arthritis to start with. The rotator cuff tear can contribute to your arthritis. So for a lot of patients, the first question is, what do I do about this? Well, just like we talked about, I won't harp on this over and over, but we obviously try to exhaust all non-surgical treatment options to begin with. We, in addition to our traditional injections, we also offer PRP injections, which is kind of like a stem cell type product that we could talk more about, but it's kind of a talk in and of itself. And so the long and short of that is that we just have these other options that are non-surgical options. But if you fail these, it's important to know that shoulder replacement is probably your best bet. And this is right behind knee and hip replacement is the third most common joint replacement in the United States and worldwide. So it is a highly successful procedure. this is a study that showed that the increasing demand in shoulder replacement is anticipated that it will grow 300 to 700% in the next 20 years. So it's really a procedure that is much more successful now than it was 10 or 15 years ago. It has grown in popularity and really for me is my passion. And I feel like I'm able to provide an absolutely phenomenal outcome for a lot of patients if you're the right patient and you've exhausted the non-operative treatments. This is a study that showed that 95% of patients report improved pain profiles and having less shoulder pain after their shoulder replacement. And, shoulder replacement, I think Christy and I are going to be working on kind of doing a part 2 of this talk down the road where we talk more about shoulder replacement in general and with a little bit more specifics. But the long and short of the way we do this is that we essentially get rid of all of the arthritis and we replace the beat up cartilage with a resurfaced ball and a resurfaced socket. And these implants serve to make a new nice shoulder, a smooth surface. You no longer have a worn out ball and socket in there. You have a new bright and shiny ball and socket in there. So this is, again, we'll go through this pretty quickly, but we have anatomic shoulder replacements, which is a traditional ball and socket. And then we have bone preserving options. And then we also have reverse options. Again, these are all technical things that I could talk for days about, but the long and short of it is that you have to trust that our goal is to get patients back on the water, back into whatever your activity of enjoyment is, whether it's taking care of the house or working in the garden, hunting, fishing, things like that. We're able to get you back into those activities. And then unfortunately, some people fall and they have a fracture of their shoulder. Fortunately, a lot of these can also be treated conservatively and treated non-operatively. But if this fails, we do have treatment options where we put plates and screws in there, or sometimes we do provide a shoulder replacement for that type of fracture too. Previously, this problem on the left really didn't have a good solution for any patient. And fortunately, now we have a reverse shoulder arthroplasty that provides patients a phenomenal, really high quality outcome in the face of what was previously really a non-treatable problem. We also have made great advances here where I'm able to offer a custom shoulder replacement for my patients. And the goal of this is to improve surgical outcomes and give patients a better functioning shoulder that's going to last longer for these patients. And so this is something that's really new, advanced technology that I've been able to introduce here to East Tennessee. I think I was the first surgeon here in East Tennessee to perform a custom shoulder replacement. I'm happy to say that my patients have just really done well and are doing just really well, and they've been very pleased with their outcomes. This is a picture of one of my patients at 6 weeks out from a total shoulder arthroplasty. She's no longer in pain, and as you can tell, has nearly normal motion at 6 weeks out. We'll skip this. This is a video that I promise I'll show you if you come visit with me. But it's just, it's essentially the outcome of finding the right solution with the right patient and the right hospital and the right surgeon. We have a number of studies that show that finding the right shoulder surgeon and a shoulder specialist that specializes in shoulders is really key to having a good outcome. We have correlations through multiple studies that show that patients do better based on having a shoulder specialist, higher volumes that really specialize in shoulder and elbow replacements and surgery. This creates better outcomes for patients. These are some of the things my patients have been saying. Most days I forget I've had a shoulder operation. It works better than my normal shoulder. I'm pain-free and I'm able to reach and lift unlike I have in many years. I have 100% normal range of motion. I'm back to performing, things like bike riding and Pilates and weightlifting. So these are just some of my patients' quotes. But again, it goes to show you that the reason that you do this really is to restore function and relieve pain and get you back to the activities of daily living. Just having a pain-free shoulder is a huge lifestyle improvement for most people. And so hopefully we can find that solution for you. I thank you for your attention. Hopefully you found that informational. And then I think at this point we'll open it up, question and answers. So I'm happy to answer any questions you may have for me. I will go ahead.
Hey, this is Christy Parker with TOC, folks. I have asked if you don't mind if you can put your questions in the chat box. If you're having any difficulty finding that, it should be on the bottom of your screen. I am going to go ahead. I'm sorry. Okay, here we go. Dr. Kennon, do you see the chat box there? John Schreiner, oh, okay, is asking about how far out you're booking your consults right now.
Unfortunately, Christy, I think you may be the only ones.
I think that's just because it came through in private, yeah.
Yeah, we'll just kind of make this work. So I'm able to see people within a week for sure, sometimes the next day, depending on my surgery schedule, but I'm not booked out terribly far. I can usually get you in within a week. So I see patients typically Monday, Wednesday, and Friday. And so particularly if you're taking your time out of your lunch to come see me today during our talk, then I'm sure we can get you in pretty quickly.
Dr. Kennon, can you see some of the chats coming through now?
Yes, I see. What sort of pain can someone have with a damaged bicep tendon? So the bicep runs, hopefully you guys can see me, I don't know, but I have a little model here. Can you see that, Christy?
I can.
Okay, so this is a model of the shoulder, and this is the rotator cuff here in the front and up top. I can kind of spin it around, but the bicep tendon runs in the front of the shoulder and runs down the front of the arm. And so oftentimes people relate bicep problems to the front of the shoulder. And so it's usually not the back, it's usually really the front of the shoulder. And a lot of times people will have a pain that radiates down the front part of the shoulder and the upper part of the arm. So then I see, I've been a runner for 30 years with no injuries until 3 weeks ago. I stumbled and fell and had x-rays and told I had an AC separation. Pain continues in that area, but now extends down to my rotator cuff. And why is that? Well, I will tell you that when you have a fall like that in AC separation, it will definitely take time to recover from it. So I do not anticipate that you would be better in 3 weeks. The important part is that you've had the appropriate workup and you're seeing a shoulder doctor that can tell you whether or not you need surgery or you don't need surgery. For AC separations, a whole lot of these can be treated non-operatively. And so I would encourage most people to seek non-operative treatment at first, but you should also be in with a physical therapist and be working on getting your motion back and continuing to improve with that. The question as to why your rotator cuff hurts as well, it's hard to say without seeing you in person. Sometimes you could have a concomitant rotator cuff tear, but oftentimes it's usually just inflammation and swelling related to the actual fall and the injury. And so, I think the important thing is to make sure that you're happy and you feel confident with the physician you're seeing. And if you are, then that's great. And if you're not, then I'm happy to see you. Diagnosed with bone-induced impingement. What are the issues if I don't have surgery to grind down the bone? So there are no proven long-term effects if you don't have surgery. And what I would typically tell people is that if you have impingement, most of that does respond to conservative treatment. But if it doesn't, then there is oftentimes, like I said, a minimally invasive procedure where you can shave off that bone spur that's pinching the rotator cuff. There are some camps of people that believe that if you don't shave off that bone spur, that you can put yourself at risk of causing a rotator cuff problem down the road because, as this patient mentioned, it's kind of a mechanical induced problem. And so oftentimes we do have to address that surgically, but honestly, I can tell you that's a very small subset of patients, probably well less than 5% of my patients am I going to recommend doing surgery purely for impingement, unless you really have just tried everything else and it's still bothering you. The next question is, do I come to Lenoir City? John, right now I do not. That may be changing in the near future. But what I can tell you is that I see patients at Park West. And I would hope that if things have not gotten better for you, that you'd be able to come visit me at Park West. And I may be in Lenore City at some point in the future, but right now Park West is probably the closest option for you. And we do, we have a good clinic here at Park West. We can usually get you seen in a pretty efficient manner. What is the popping sound that I hear when I rotate my shoulder? That's tough to say without seeing you. It could be arthritis, it could be a bicep tendon, or the rotator cuff. So there's a whole host of possibilities when it comes to that. It's a little bit hard to diagnose over the computer, but again, a lot of times we can get to the bottom of it. What I do tell people is that if it's non-painful popping, I don't worry about it. For instance, my ankle pops and creaks on me. I don't really 100% can't tell you what that is, but I can tell you it doesn't stop me from doing what I want to do. And it doesn't hurt terribly bad, so I don't worry about it. And so I tell you that to say that if it's not bothersome to you, I wouldn't worry about it. If it is painful and it is bothersome, then you may need to get that looked at and make sure there isn't more something more ominous going on there for you. What can we do to avoid shoulder injuries? That's a great question, Bruce. I think the most important thing to avoiding shoulder injuries is maintaining a healthy lifestyle. Trying to avoid things that can induce shoulder injury, like diabetes and smoking. And if you are a diabetic, trying to keep your blood glucose under control. The other thing is just keeping an active and healthy lifestyle. I take care of a fair amount of people that are very active in the gym. And, while certain things of CrossFit and things of that really high demand nature, those things can cause shoulder injuries, unfortunately, but oftentimes at least staying active and, low weights, those kind of, healthy shoulder activities are important to maintain a healthy shoulder. If you're ever in doubt, it's always best to get checked out. And then oftentimes we can get you in with a therapist that can work with you, even if it's only 1 or 2 sessions, to help teach you a series of activities and exercises that can actually keep your shoulder in a healthy situation and avoid shoulder problems. Does arthroplasty cleanup process work for arthritis as a prelude to replacement? So an arthroplasty is synonymous with replacement. So arthroplasty and replacement are essentially the same word. Arthroscopy, which is probably what you meant, arthroscopy is a cleanup, or is where we use a camera and small instruments to clean up the joint. We do that in the shoulder and sometimes in the knee, that type of thing. I would tell you that the cleanup process for arthritis in the shoulder is not terribly predictable. I have seen patients that it works for. And so it's a very individualized discussion regarding that. I would tell you that in general, the pain relief from that is not near as reproducible and predictable as a shoulder replacement. But for the right patient, depending on your age and your activity level and your demands, it is an option for some patients. But you definitely need to make sure that you're in the right hands with that and that you're making a really educated decision before you undergo that procedure, making sure that you've understood what the likelihood of success is with that versus, you don't want to undergo a procedure that just doesn't have a highly likelihood of success, because then you found yourself in a position where you put yourself at risk and the benefit may not be that likely, whereas the risk benefit of other procedures. And so that's kind of a balance. And, I pride myself on understanding patients in terms of their needs and their demands and finding the right solution for each patient. And so, that's something that you just have to talk to your doctor about and understand those options. Sorry, I'm working through these questions. I appreciate all the questions, guys. So I have a patient that has had pain in the front in the biceps as well as along the top of the shoulder blade. The patient's been diagnosed with frozen shoulder, but may also have rotator cuff injuries. They've tried therapy and cortisone, which helps, but not fully relieved it. what is frozen shoulder and how does that relate to rotator cuff injuries? That's a good question, Kristen. So frozen shoulder, I did not talk about today. It is a common entity. That's probably 10-20% of what I see in terms of non-operative shoulder things. Frozen shoulder is an inflammatory condition that can be from a number of different entities. Some people get it for no good reason whatsoever, other than what I term bad luck. It means, you know what, we don't know why. Maybe mom had it, maybe dad had it, and we can blame them. But sometimes it's just purely bad luck. Other times there are underlying conditions that can increase your risk of frozen shoulder. But for whatever reason, the shoulder becomes inflamed and the actual capsule of the shoulder tightens up. And so if you imagine this model, the capsule is a thick covering that kind of comes over the front of the shoulder like this and kind of encapsulates the entire shoulder. And that tissue becomes thick and fibrous. And then that limits your motion and can become incredibly painful. So that's what frozen shoulder is. Now, in terms of that relating to rotator cuff injuries, they're not intimately related, but there's no rule that says you can't have both. And so that's really where an exam and an MRI can be helpful. Another patient diagnosed with frozen shoulder. And so the surgeon told him that the cap was very thick, gave him a shot, but no MRI. Pain is better, but mobility is improving very slowly. X-rays show no fracture. So the MRI, frozen shoulder is typically a diagnosis that we make based on a clinical exam more so than an MRI. I do get MRIs if I think something else might be going on, or if I want to rule out a big rotator cuff tear or something else going on. You know, if you're improving with injections and you're improving with therapy, then I tend to tell people to continue the course. But if you ever feel like if you've hit if you've stalled out in your progress or you're not getting better, then at that point for me, I typically get an MRI. The other thing I would tell you, Lisa, is that just make sure you feel like you're in the hands of a shoulder specialist that does a lot of shoulder and not just an occasional shoulder. And somebody that is pretty comfortable treating this. I did research on frozen shoulder years ago. I've not done any on that recently, but I do have published studies in the frozen shoulder world. And so, you know, it is an entity that we do see pretty commonly, and it can be quite debilitating. The good news for you is that I would tell you probably 90 to 95% of people never actually need shoulder surgery for frozen shoulder. But nonetheless, it can be quite nagging. It can be a very frustrating diagnosis. And so sometimes it just takes the right education and understanding the pathophysiology behind the problem so that you know that, you know, hey, I am making progress and I am going to get there. So make sure you, make sure you're in the right hands. And obviously, if you feel like there's any questions or you're not happy with your care, we're happy to see you. So another episode of frozen shoulder, that's 3 in a row here. Let's see here. 50% reduction of tendon. Sorry, bear with me. The patients had frozen shoulder, but also had some attrition of the shoulder of the supraspinatus, improved to almost normal. So if you've improved, then I would tell you that's a good thing. Is there an increased chance of arthritis if I have the surgery done? And what is the surgical problem for the circumferential problem? Or option. So for frozen shoulder, I do not think there's any direct link between frozen shoulder and an increased risk of arthritis. So that's good news for you. Unfortunately, the frozen shoulder, if you've gotten close to normal, then I would not pursue surgical treatment at all. I tend to reserve surgical treatment for frozen shoulder for people that that are not getting better, that you failed shots and you failed therapy and you're not getting better. But if you're getting better, I would not recommend surgery. However, if surgical options for frozen shoulder is we go in, I do mine arthroscopically again, so you only have a couple very small poke holes, and we go in, we essentially release and open up that shoulder capsule. And once we release that capsule, we get you into aggressive therapy, and typically speaking, people get better. So hopefully that answers your question. Here's another patient that has seen a patient in Lenore, or seen a physician in Lenore City for torn rotator cuff. And they're asking, does Dr. Brady perform the same procedures I do in terms of rotator cuff surgery? In general, Dr. Brady does offer a lot of the same procedures for the rotator cuff. He and I do some things differently in the shoulder replacement world. We both perform probably 99% of the same surgeries, and I will brag on him. Dr. Brady is a great surgeon and one of my good friends. There are certain things that he's not as comfortable with, and he sends those to me. In general, I would say that he takes care of a handful of the younger, maybe athletes and like high school students and, college pitchers and, things of that nature. I do some of that as well, but he probably specializes in more of the younger patient. And I probably specialize in a little bit of the older patient. But we overlap a fair amount. And so, certainly you're welcome to see him. And like I said, I have nothing but good things to say about him. He's one of my good partners and friends. So semi-retired PT who has recently moved to Knoxville, and it's good to know surgeons I can refer to. So yeah, Mary, I'm happy to see folks whenever, and we'll be happy to see them. Going through these, had rotator cuff surgery 7 years ago, started hurting again from time to time. I believe I have anchors installed. Could they have come out, or are they coming loose? So what I would tell you about rotator cuff surgery, if you've done well for 7 years and now started having problems, chances are the anchors are probably okay, but it's hard to know that without imaging. But what can happen more commonly than the anchors failing is that the rotator cuff unfortunately can tear again, or it can stretch out over time. I tell people in general that getting rotator cuff problems or rotator cuff tears is a lot like getting gray hair or losing our hair or both. And I would say that kind of as a joke, but if you think about it, when we're 18, most of us have a good, healthy, good set, good head of hair. But as we age, the hair gets a little thinner sometimes, doesn't it? And occasionally it gets a little gray, or it might fall out, right? And so the rotator cuff, as we age, tends to get a little thinner and may not be quite as robust as it once was. And so that's why a lot of, the incidence of rotator cuff tears goes through the roof as we reach our particularly our 60s and 70s, but oftentimes even in our 50s. And so if you've already had rotator cuff surgery once, unfortunately, all bets are off as to whether or not you may have had something going on again. So, what I would encourage you to do in that situation is probably get it checked out. It may be nothing. You may look great on x-ray, and all we need to do is talk about getting you into some strengthening exercises, or perhaps an injection may help you feel better. But again, it's kind of hard to see you in person.
Dr. Kennon, I know we're about 1 minute before 1 right now. Mm-hmm. How are you doing on time? Do we need to?
So I think it looks like we're getting through most of them. We talked about, I'm just scanning these real quick, Christy. We talked about bicep pain. That was another question. So who is a high school having pain radiating down her shoulder for several months? If you're having radiating pain, that could be coming from your neck or your shoulder, but that probably needs to be seen. And then we talked about rotator cuff and a question about tennis elbow with rotator cuff. Those are typically two different problems, Maria. And I think that might be almost it, Christy. So I think sorry if that was a little quick, guys. I tried to speak quickly to get through all of these questions, but I appreciate all the questions. I'm always happy to answer them.
Well, what I'd like to kind of close up with is just thanking everybody for participating in this talk. I think this has been really great. We appreciate you letting us sort of test it out on you. Hopefully it's been very helpful. If anybody is interested and would like some more information about scheduling an appointment with Dr. Kennon, there's a couple of different easy ways to go about doing that. First of all, we do have online scheduling on our website. It's TOC Docs, so TOCDOCS.com. And you'll just go to Dr. Kennon's page, and we have a really nice platform for online scheduling. If you have questions or you need some assistance with scheduling, you can email me and the marketing team at feedback, which is F as in Frank, EE, D as in dog, back, BACK, at talkdocs.com. You can do that. You can call our scheduling department at 865-690-4861. Or feel free to message through Facebook. That's also an easy way to get a hold of us. So just kind of wanted to leave everyone with that. I'm going to send out an email with all of that information after this, and please don't hesitate to reach out. Also wanted to put out there that we're going to be doing a variety of these kinds of talks. Hopefully we'll have Dr. Kennon do a special custom shoulder replacement talk for us coming soon. So be on the lookout for that if you're interested. Dr. Kennon, thank you.
I'll just wrap up by saying thank you again, guys. Again, this is kind of new for us, and so hopefully it was helpful, and I look forward to seeing you or your family or friends in the future.
Thank you, everyone. Have a great day.
Take care, guys.